General principles of pharmacology. Drug nomenclature. Each drug has 4 names: code name, chemical name, non-proprietary name, generic name, and proprietary name, trade name. Why are there 4 names of a drug? Naturally, each name has advantages as well as disadvantages. Code name. The code name is the first name that is given to a drug by the pharmaceutical manufacturer. After the synthesis of a lot of chemical compounds, some code names are given before screening its role in physiological processes done in the laboratory. It may be an abbreviation, a numerical, or a combination of both. For a code name of a drug BAY 09867. BAY comes from the name of the famous pharmaceutical company Bayer. The code name has little chemical or pharmaceutical significance other than to the laboratory personnel working with the compound. Code name of a drug is not used subsequently with some exception like a Ca2 plus chelator A23187. Chemical name. The chemical name is the name used by the organic chemist to indicate the chemical structure of the drug. When a drug with a code name is found to be effective after preliminary screening, then its chemical structure is studied. In the case of BAY 09867, the chemical structure is LCYCLOPROPYL6-fluoro-L, 4-dihydro-4-oxo-7-piperazine LYLQUINOLINE3-carboxylic acid. The name is quite long and difficult to remember, spell, and pronounce as the most organic drug is a complex molecule. The name is not suitable for routine use by medical professionals or common people. However, this name is very helpful for the discovery of new compounds. Non-proprietary name. If a drug appears promising and the manufacturer wishes to sell it in the market, then a non-proprietary name is given.
It is wrongly called the generic name.
The generic name designates a family relationship among drugs. For example, benzodiazepines, barbiturates, catecholamines, etc. Benzodiazepines include a number of drugs like diazepam, nitrazepam, flurazepam, etc. Medical professionals choose the non-proprietary name for its simplicity than the chemical name, and it is easier to remember. The non-proprietary name is always concise and meaningful. For example, the word methylnitro is condensed to metro and nitazole, which is due to its imidazole ring. Metoclopramide is the condensed form of the word methoxychloroprocainamide, where me is retained and this is written as T, chloro is written as clo, and procainamide is written aspramide. The word bacitracin was originated from the microorganism Bacillus subtilis and tracin, Tracy, the name of a young girl from which the bacteria was isolated from the debrided of compound fracture. Like this, aspirin was derived from A for acetyl, spur for spursor, a German word, sar means acid, or the genus Spirea, and in is a popular suffix for drugs of the times. The name gives hints about the chemical structure of the drug, i.e. the acetyl product of salicylic acid as an analgesic. But non-proprietary names, except for a few, usually do not indicate the stereochemistry of the drug. The non-proprietary names are chosen by the official agencies at International Non-Proprietary Names (INN)(B). British approved names BAN, and C. United States approved names USAN, USP, and FDA. According to the WHO, the following general principles are adopted in naming a drug in the non-proprietary naming. Names should preferably be free from any anatomical, physiological, pathological, or therapeutic suggestion. B. A name should be formed by the combination of syllables from the scientific chemical names in such a way as to indicate the significant groups of compounds. C. The name should not exceed 4 syllables, they should be distinct in sound and spelling. They should not contain a terminal capital letter or number. D. The following suffix should be use. D. INE, in case of alkaloid, in case of glycoside, OL, in case of alcohol, phenol, AL, in case of aldehyde, ene, unsaturated hydrocarbon, 1, saturated hydrocarbon. The alkaloids are morphine, atropine, quinine, nicotine, reserpine, papaverine, pilocarpine, and so on. However, adrenaline, pentamidine, and procaine are not alkaloid even the names end in INE. The ending INE is derived from the amine which is an organic base. The glycosides are digoxin, digitoxin, and wabain. Nowadays we can easily identify the nature of a drug by studying the suffix. For example, most of the beta-adrenoceptor antagonists have suffix olol, for example, atenolol, propranolol. On the other hand, calcium channel blockers of the dihydropyridine type have suffix dipine, nifedipine, nicardipine. Angiotensin-converting enzyme inhibitors have the suffix pril, captopril, enalapril, lisinopril. BAN versus USAN. The non-proprietary name of some drugs in UK, BAN, and USA, USAN, is different. The bronchodilator salbutamol, according to BAN, is known as albuterol in USA. Furosemide, according to BAN, is also known as furosemide, according to USAN. Confusing name. Sometimes different drugs have closely similar names. For example, acetazolamide, carbonic anhydrase inhibitor, and acetohexamide, oral hypoglycemic agent, chlorpromazine, antipsychotic drug, and chlorpropamide, oral hypoglycemic agent, piperazine, anthelmintic, and pyrancepine, antimuscarinic agent, terbinafine, antifungal drug, and terfenadine, antihistamine. These cause confusion of names and the dispensing of wrong drugs. Trade name. The fourth name of a drug is the trade, proprietary, or brand name. It is shorter, simpler, easier to remember, write, and most frequently used. The trade name is different from the non-proprietary name. That is, a drug has a single non-proprietary name whereas it has several, maybe several hundred or thousands, trade names. For example, Glaxo Wellcome Limited uses its bronchodilator drug as Ventolin instead of the non-proprietary name, salbutamol. Different pharmaceutical companies market the same drug with different trade names which produces a lot of confusion. A trade name frequently appears with the sign registered at its upper right corner which indicates that the name is registered and its production is restricted to that pharmaceutical company as the sole owner. So, a trade name refers to a particular company. There is a great debate about the use of non-proprietary versus trade name in the prescription. However, drugs sold under non-proprietary name are usually cheaper than those sold under a trade name. There are valid arguments on both sides. So, students should acquaint themselves with both the non-proprietary and the trade names. Unlike the non-proprietary name, the trade name is registered and its use is restricted to the owner of the copyright. Even when a drug is new and is protected by a patent, it may be licensed for use by several companies, and it then appears under a variety of trade names. The patent will last only 20 years after its issue date, but the trade name registration will last for at least 50 years. How are drugs classified? There are several thousands of drugs available for the treatment of diseases. So, it is not so easy task to classify them uniformly. There are several ways to classify them: a chemical nature of the drug, b. disease condition, c. organ system affected, d. generation, e. receptor agonist and antagonist, and f. drugs approved for marketing. Chemical nature of drug. Some drugs are classified purely on the chemical nature: sulfonamides, benzodiazepines, catecholamines, barbiturates, thiazide diuretics, and imidazoles. There are several thousands of sulfonamides, of which clinically important are sulfadiazine, sulfadimidine, sulfamethoxazole, sulfasalazine, etc. All the sulfonamides have a basic nucleus aminobenzene sulfonamide. The drugs like diazepam, nitrazepam, flurazepam belong to a group benzodiazepine. Benzodiazepines refer to chemical compounds containing a benzene ring fused to a 7-member diazepine ring. Similarly, the term catecholamine is derived from the catechol nucleus and 2 carbon side chains with a terminal amino group, ethylamine. The catechol nucleus consists of a benzene ring and 2 hydroxyl groups. That is why catechol nucleus of catecholamine is also called 3,4-dihydroxybenzene or MP-dihydroxybenzene. However, all the drugs are not classified based on their chemical nature. Pharmacotherapeutics. Drugs may be classified based on symptoms or diseases in which they are used. This method of classification is sometimes restrictive or broad. For example, the drugs used for the treatment of various diseases such as hypertension, malaria, tuberculosis, or epilepsy may be grouped by adding the prefix anti. We use the term antihypertensives, antimalarials, antitubercular or antiepileptic agents. These are examples of restrictive classification. Antiviral, antibacterial, or anti-cancer drugs are examples of broad classification. Aspirin or paracetamol is used to relieve pain. These are belonging to analgesics. In this method of classification, some drugs are used in other diseases. For example, a diuretic is used not only as an antihypertensive drug but is also used in other diseases. Organ system affected. Drugs can also be classified based on the organ system affected, such as drugs that act on the nervous system, gastrointestinal tract, and cardiovascular system. Drugs that affect gastrointestinal function may be further categorized as drugs used for the treatment of peptic ulcer, antidiarrheals, laxatives, digestants, and antiemetics. Unfortunately, this classification does not include all the drugs. For example, some drugs act on microorganisms or parasites rather than the host. So, they are classified as antimicrobials or anthelmintic. Generation. Recently, there is a tendency to classify some drugs, antimicrobials, oral sulfonylurea hypoglycemic agents, and retinoids, based on generation first, second, third, or fourth. For instance, cephalosporins are classified based on general features of antimicrobial activity. Drugs of the first generation, cefazolin, cephalothin, cephalexin, cefadroxil, have good activity against gram-positive bacteria. They have relatively modest activity against gram-negative bacteria. Drugs of second generation, cefuroxime, cefaclor, cefoxitin, cefamandole, cefonacid, cefetadine, ceforonide, have increased activity against gram-negative bacteria. Drugs of third generation, cefotaxime, ceftriaxone, ceftazidime, cefrodoxime, ceftriaxone, are more active than the drugs of second generation against gram-negative bacteria. They are less active than the drugs of first generation against gram-positive bacteria, but they can cross the blood-brain barrier. Oral sulfonylurea hypoglycemic agents are divided into 2 generations, first and second. Drugs of second generation, glibenclamide, glipizide, gliclazide, are considerably more potent than the first, tolbutamide, tolazamide, chlorpropamide. Retinoids are classified into the first, second, and third generations. Receptor agonist and antagonist. Nowadays it is found that a lot of drugs produce their pharmacological effects by acting on their specific receptors. The definition of receptor has been described later. Based on this concept, drugs may be classified as receptor agonists and antagonists. For example, dopamine receptor agonists are levodopa, bromocriptine, and apomorphine. Dopamine receptor antagonists are chlorpromazine, domperidone, pimozide, and haloperidol. Like dopamine receptor agonist and antagonist, others are cholineceptor agonist and antagonist, adrenoceptor agonist and antagonist, histamine receptor agonist and antagonist, 5-HT receptor agonist and antagonist, etc. Drugs approved for marketing. While prescribing a drug, it is classified into three groups: over-the-counter (OTC) drug, prescription-only medicine (POM), and controlled drug. OTC drugs are those which can be purchased without a prescription. These drugs are safer and can be self-medicated. It includes analgesics like paracetamol, antacids, antidiarrheal agents, and antiseptics. The choice of OTC drugs is not strictly followed in developing countries. A drug that requires a prescription from a licensed prescriber to be dispensed by a pharmacist is POM, for example, antihistamines, anti-anxiety drugs, antimalarial agents, and antibiotics. Some are called controlled drugs, for example, morphine, pethidine.